And I think we'll go ahead and get started. So good morning, good afternoon, good evening. Thank you very much for joining today from different parts of the world. We really appreciate that you are here. So before I introduce myself, I'd like to just actually open with a word of prayer. So let's pray. Lord, we thank you for today. Thank you for gathering us to think together, to listen, and understand what is happening in Christian health worker training institutions around the world. We are grateful for the work of all of those schools and the people that make them up and the training that they provide. We're thankful for the people here who want to see how to forge partnerships and learn about this new database about them. We're thankful for the volunteers who have spent their time to make this database a reality and pray that you'll guide us through in this discussion. Help us listen to you as we need today and keep our technologies all working. In Jesus' name, amen. Terrific. Well, if you've also just joined, please continue to introduce yourself in the chat. I am Doug Fountain. I am the executive director. I'll be moderating the conversation today. I'm the executive director of Christian Connections for International Health. I'm based near Washington, D.C. CCIH is a global network of 125 organizations, including secular and interfaith partners, who are committed to advancing basic health and wholeness. And CCIH members work in over 90 countries. In fact, over half, as you can see on the screen here, over half are actually based in low and middle income countries. CCIH serves as the secretariat. You can go to the next slide. CCIH serves as the secretariat for the Christian Health Asset Mapping Consortium, which was established in 2022 due to the need for improved data regarding the scope and scale and location of Christian health assets in low and middle income countries. Enhanced data facilitates inclusion in planning, resource allocation, and research. And the members of this consortium include the Africa Christian Health Association's platform, the Catholic Health Association of the US, Chorus International, International Christian Medical and Dental Association, and the World Council of Churches. CHAMC maintains a registry of databases, shares analyses, and improves representation through quality data on Christian health assets. So I'm here wearing the hat as Secretariat of CHAMC for today's webinar. Our topic today is something I'm very excited about. It's coincidentally, we hadn't planned it this way, but it's taking place during International Health Workers Week. And we acknowledge the advocacy voice of the Frontline Health Worker Coalition, together with the World Health Organization, in lifting up all direct health service workers around the world. And through this advocacy, we know that there are millions of people who are concerned about the future of health workers and the training and equipping of health workers. And so it seems particularly timely to have this focus on this data resource that we'll be sharing. My own background, I worked at Uganda Christian University, where I helped start advanced nursing, public health, and then eventually medical programs. I saw firsthand how excellent Christian health worker training instills both practical skills and a spiritual foundation for holistic health that serves people, as well as providing a tremendous spiritual foundation for transformational leadership. So we know what the value is of this. And several years ago, in fact, I was in a meeting with over 20 corporations and about 25 NGOs talking about the future of global health. And the chief of staff of one of the largest corporations in the US stood up and asked in the room, who among you have invested in improving quality health worker training? Who among you has done anything to invest in quality health worker training? And he waited, and nobody raised a hand. Then he said, you have no room to complain about the quality of health workers. And I really took that to heart. Not only did I have the personal experience that I was fortunate to have, but I also heard that clarion call to do something to strengthen the training. And so it's easy to see the impact of exceptional Christian training. When we take countries like India and we look at universities like Christian Medical College in Vellore or St. John's in Bangalore, you see what kinds of training they provide and what an impact it has on the country, you realize the supersized impact of Christian health worker training. And so, with that in mind, we were very excited when volunteers Gary and Ron stepped forward to actually help us be able to document the health worker training institutions as part of the Christian Health Asset Mapping Consortium. Their volunteer efforts is creating a whole new resource, a whole new opportunity to start working collaboratively to communicate with and to strengthen these vital institutions and learn from them as well as they are doing exceptional things. So here's the flow that we're going to follow today. We're going to have three presentations. Dr. Gary Cloud is going to present first. He's a healthcare administrator with experience in hospitals, health management organizations, community health centers, and universities. He's started medical, dental, and physician assistant and other health profession colleges committed to training healers, especially for community health centers. He's now volunteering for CCIH on this work that we're going to talk about. Following Gary, we'll hear from Ron Yee, Dr. Ron Yee, who served much of his career as a clinician, medical director, and CEO of a community health center serving farm workers in California. He then served for over a decade as the chief medical officer of the National Association of Community Health Centers, which supports 15,000 clinics in the US. And that was prior to this new phase of being called to work with Gary, his prayer partner, on preparing leaders for kingdom work and then volunteering with CCIH. Finally, we'll hear from Carolyn O'Brien, who serves as the program manager for CCIH. She monitors project activities, leads CCIH efforts on this mapping consortium, as well as our 30 by 30 Health Systems Initiative and the new Faith Consortium for Climate Resilient Health. So we'll hear from all three of them, and we'll then have ample time for discussion. So if you have discussion questions, please feel free to keep track of them for discussion time, but also feel free to put them into the chat box. That's the best way. That way we can keep track of your questions, is if you put them in the chat, and maybe we'll even be able to answer some of them there. So with that, I'm going to now hand over to Gary, who will get us started. So Gary, why don't you tell us about this? Thanks.
Thank you, Doug. And Ron and I feel so blessed that you've you've asked us to help put together this database. So it's been a real treat for us. And again, thank you. Thank you. The database development is designed in 5 phases. The first one was a design and beta test on a couple of countries, the database itself. From there, we did a series of internet or artificial intelligence searches on each country. I'm looking up the Christian colleges and universities and then checking to see if they had health professions, or looking up the health professions institutions to see if they were from Christian institutions. In the midst of vetting each of those institutions within the countries, we would check at the bottom of their web page, if they had a web page, and often there would be a list to say, here's an association we belong to, or here's a accrediting body that we work with. And so we, in the next phase, checked out those lists plus various lists that CCIH shared with us to get us to the point where we are today, which is friend sourcing. While we have this data put together, it is merely data. It is not put together by people who are on the ground and understand what's going on in their region. And we're expecting friends of CCIH to step in and say, this is incomplete, this is incorrect, and in order for the database to be accurate over the years. And then over the years, it will really matter that we have that there is a consistent work on the database, that somebody keeps it updated, because places are going to open and close as we go along. Hey, next page, please. Yeah, so after we've identified a potential institution, we would then check and see if it met the standards we'd set up for being a Christian institution. Of course, we understand that institutions are not Christian, individuals are, but institutions can be tools for Christians. And so anyway, we have standards for that we'd check against. And then next we would verify that it had one of the multiple different health professional degrees that we included in the database. And we looked for some inspiration. About maybe a third to a quarter of the institutions had something that really impressed us that we thought might be of value for other institutions to read about or see. Ron's going to share some of that a little bit later. And from there, we figured out the ways to get this information into the database itself. Next slide, please. Here are a few of the things we had to really deeply consider and frankly pray our way through in the design of this database. And the first is, what is a Christian institution? What is a Christian organization? The second is to decide what is a country. There's, for instance, think of Taiwan. Is that China? Is that Taiwan? We took a very liberal approach. In other words, as many different countries as possible, but we tried to make note if others had claims on the territories for that. A next issue we had was what to name, what to call an institution. Do we call it by its English name? Do we call it by the name that it's going under? We decided we were going to use whatever name was being used in the source that we were using to identify the institution itself. In this changing world, what does location mean matters a lot here too. So for instance, if it was a medical school that had 7 locations, are we going to call those 7 medical schools? We decided to let that be sort of self-identified. If the institutions seemed to be thinking of those as separate medical schools, we included them as separate medical schools. But this will be an increasingly complex question over the years as distance education is allowing learning in place and learning at your own speed. And then, of course, what is a health profession was one of the considerations. We decided at this point in the database to only go with those providing direct hands-on care. But there were questions like, what is a physician? A physician has a different definition in England than it does in the US, than it does in China. And so we decided to use local standards. So think of areas of care, say oral health care, with a local standard, deciding if that's a dentist or someone of a lower trained level. Next slide, please. So, here are some potential, I think, flaws in this database and why we need your guys' help. Right? So there's missing information. We did artificial intelligence searches, rather extensive ones, but sometimes you could call that artificial unintelligence searches. And it does not make sense. There are institutions that do not have their information up, say, on a web page, and artificial intelligence may not have gathered if it wasn't a web page to be found. So there's missing information. We're going to be counting on friend sourcing to help us there. Likewise, there'll be inaccurate information. Certainly, Ron and I are human and flawed, and not adept in various languages. Perhaps a little adept at using internet to figure that out. But same thing. Where this is inaccurate, where we've put things down incorrectly, we need your help. We need the friend sourcing, and we want to continue to keep this database up to change. And of course, the constant change. Places will be closing and opening regularly. And so this will be out. This is out of date the minute that we print it at any one time. And then finally, it's going to make the most sense that there's curated referral. So as the information comes back from friend sourcing, as opposed to allowing folks direct access to the database, we need some category fidelity. And so it would make most sense to send the referrals, the recommendations to the curated central at CCIH at this point, and so that we can make sure we get it in the right format, put it in. Next slide, please. Yeah, and I think back to you, Doug.
Thank you, There we go. Thank you, Gary. Really appreciate that. You know, Gary, I think about still the first day that we sat down together and just started to imagine what we might create. And as we are getting ready to really unveil more about this, I continue to marvel at how much this has really taken root and how much you've been able to do, you and Ron. And so thank you for walking us through that. We'll come back to questions and comments in a bit. I'm happy to turn it over to Ron now to take us to the next level. So thank you, Ron. Over to you.
Yeah, thank you, Doug. And again, Gary and I are very humbled to be able to be involved in this work and just amazed at all the people looking through the chat around the globe focused on health professions education and sharing the gospel. So thank you for that. I have the privilege of just sharing as Gary and I went through these data searches. We would find little nuggets and words of inspiration or examples, and we would share this with each other. And I just chose 3 out of the many that we have. But over the time, we were just struck by a few things. The first one is just really how many institutions over 150, 165 years have really maintained their focus, and they've had no mission drift, and they've continued their focus on health professions training, but the gospel message and really sharing God's love through the training. And these are just a few of the examples. Some of the mottos that have continued on, such as "In thy light we see light," "To God alone be the glory," and "The word of God endures forever." These are from universities and colleges that have maintained this. And as we search through, we actually look at some of the comments of the students, the present students, how this has continued on. So we are quite inspired by that. The second example is we were reading through and found an article about Pope Francis during the 2024 meeting of the International Federation of Catholic Universities. And really, the article brought out how the Pope shared some very clarifying comments about the whole Federation of Catholic Universities. And he really stated that in a time when education is becoming more of a business, he challenged the group that the Catholic universities must make choices that really reflect the gospel, an expression of God's love that inspires every activity of the church and the university. So we were struck by that, of just how focused the Pope was and how Catholic universities are focused on sharing the gospel and God's love. The last one I wanted to share, if you do any searches on the internet and you come up with the Macha School of Nursing and Midwifery in Zambia, if you'd like some great entertainment, they just exude the joy of the gospel and knowing Christ and really being involved in health professions, education, training, and providing health care to the most needy. But basically, just simply joy coming out of this group, multiple music videos. Please, if you have a minute, take some time to look them up and be blessed. Next slide. Well, while Gary and I, as he mentioned, are doing these searches, we're drawn to prayer. And really, we're thankful for what God has done and is doing through you all around the globe. But we're drawn to prayer because of a few things that we saw. Some of these organizations and universities and colleges have really lost their first love or in the process of losing it, kind of that mission drift of losing what their focus is over the years. And so those both really drew us to prayer for awakening and revival for these universities and colleges to really get back on track and do what God has called them to do. The third one that popped up was really interesting as we're seeing more and more psychology, counseling, behavioral health focused disciplines come up. And we know that that is such a burden, not only here in the US, but around the globe, where substance abuse and mental health issues are really coming out. So we just need to pray and help for God's help to really show us what our role is in helping to meet some of those needs that are in many countries and most of the places are insurmountable, but we need God's wisdom in that. And finally, we came to the conclusion, as Gary mentioned, not only the curation of this information, making it more precise and looking at our friend sourcing of people actually in country working with these universities, but really, how can God use this to strategically use this information to further his gospel? So this is really what this is about. And we are just, again, so thankful to be involved in this. we join you, as we know you've all been praying for these different elements, but just count it a privilege to be involved in this work. So thank you so much.
Thank you. Thank you, Ron. And really to both of you for this exceptional work. And I'll say that when we started down this path, we really had, I'll confess to both Ron and Gary. I think they know this. My expectations weren't great. I thought we'll start with 5 or 6 countries and see what we learn and see what we start to build. And then you guys really took this to heart, and you can see, and I hope everybody who's listening can see and detect that what you poured into this was not just the technical, let's pull names of organizations into a database, but you actually reflected on what it means to be a Christian university. And by coming back to the principles of what inspires them, or what inspired you in reading about them, or commenting about their first love, I think these are good reminders for us in Christian organizations to pay attention to our roots, to pay attention to our foundations, and think about what that means for us as we address the new challenges of 2025. The relevance of Christian health worker training is acute, in particularly in places like, Ron, as you're talking about, with the emergence of understanding now of mental health, substance abuse, and how its grip in society can be confronted better by the church. So we're grateful for all of the work that you've done. Now, you handed over this amazing data resource to us at CCIH, or the Christian Health Asset Mapping Consortium, and now we were able to start diving through it and to see what does it tell us. And with that in mind, I'm going to ask Carolyn to come on and talk about what she's actually seen in the data, and to talk about where we're going next with that. So Carolyn, over to you.
Thanks, Doug. Well, hi, everyone. I am just reflecting myself on how grateful we are for such thoughtful, motivated, and humble volunteers. CCIH exists because of people like Ron and Gary, and we're so thankful for that. I'm really excited to dive into the data here. It's been really awesome to look at all the different countries and glean some insight into this. After I finish my presentation here, I'll put a link to a data brief that we are launching today as part of this webinar. So you all will have the first eyes on this, and that's exciting in itself. So here is just a first snapshot of what is all included in the database. We have data from over 100 countries. You'll see globally 1,365 institutions. The data brief in our work in particular with CHAMC is really focused on LMIC context. So that we want to make sure to pull out those numbers in particular. So just in LMICs, we see there are 634 institutions. So in the global database altogether, the country with the most institutions is the US. It has 36% of all Christian health worker training institutions. But then 46% of those of the global database are located in low and middle income countries. So then looking at those countries in particular, we see India with the most at 102, the Philippines with the highest number of health worker training institutions, 48, and then Mexico at 41. Next slide. All right, and so this slide just focuses on the portion of institutions that are in low and middle income countries. Looking at the most popular programs, so the database is divided into 18 different programs. That's medical, nursing, pharmacy, behavioral health, and other. And so we have, kind of the most popular ones here are nursing, and that's specifically Bachelor's of Nursing Science type programs, psychology, and then physician. as number 3. And then looking specifically at medical and nursing programs, as we know, that's oftentimes what people are most interested in here. We can see by country for the medical programs, Tanzania has the highest number, Brazil, then Indonesia and Mexico tie there. And then the top number of nursing programs, India, Tanzania again shows up high here, and Uganda. One thing I like to note here is, in the brief, we have a nice table that explains what we mean by each of these programs and degrees. Obviously, they do differ from country to country. What is considered a Bachelor of Nursing Science? What are the standards? Things like that. And so we took a very liberal approach to capture more programs than not. So keeping that in mind, and then if you have questions about what are the different programs, what are the definitions of those, you can look back and reference that table. Next slide. And it was really great to explore the church connections for each of these institutions. I think Gary and Ron took a particular interest in this, and we have, just a very general breakdown on the slide here of Catholic, Protestant, Orthodox, and other, but in our database, we get even more specific into, okay, what was the original church connection? What denomination are they now? And to see that kind of history and the motivation behind the institution has been very cool. So we see that the majority of the institutions identify with Catholic denomination, then Protestant, small number Orthodox, and then other. And by other here, we're including non-denominational, interdenominational, Quaker Inland, Africa Inland Church, the smaller type denominations that kind of popped up in different countries around the world. Next slide. So we wanted to share a one country example, so you kind of get an idea of what we're talking about here. This isn't included in the brief, so something special to look at today. But looking at the country of Ghana, we see 10 institutions that include 22 programs. And now the columns on the right side that show the different types of programs, there are more than here. Like I said, there's 18, but I just put on the screen what exists within the institutions in Ghana. And so you can see kind of the breakdown. Some institutions have several different programs, like Central University here, the second row, has lots and lots of different programs, whereas some institutions just have one, or one or two. So it's nice to have all of this information. Along with the institution and central location in our database, we also have other locations, distance learning, website, point of contact, denomination, church connection. We have a lot of additional details, which has been helpful to provide more context into these universities. Next slide. All right, so now I'd love to take a closer look at the brief, and would be remiss if I didn't actually show a map on our mapping webinar today. So I'm going to share my screen to directly show the brief here. All right, can you all see this? I'm going to zoom as much as I can. So this is like our main table from in the brief, shows the distribution of these programs included in Christian health worker training institutions in low and middle income countries, and then distributed by region. And we use the WHO region to kind of break this down. And so we have this table included in the brief. We also have a table in the appendix that shows all the global distribution as well. So that includes high income countries as well. So you can see here kind of some things that I was talking about on the other slide. For example, looking at the totals on the right side, how high BSN programs, Bachelor's of Science in Nursing programs are, medicine, the physicians here is very high, and then also in behavioral health psychologists. And you can also see here some of the programs that we are considering in the other category, like physical therapy, occupational therapy, speech and language, vision, eye care, audiology. Here we have a couple of maps. So this first one is Christian medical programs in LMICs. So you'll see the distribution here. The darker countries, of course, have more programs. Tanzania is a top here, and you can see kind of the spread and in each of these regions. We did something similar for nursing programs, and so we have divided nursing programs into 4 different categories. So this is inclusive of all 4 of those. And so you'll see there's even more spread here in the sub-Saharan Africa region than there was with the medical programs. A lot more nursing programs here. Similar spread in Latin America, and then Asia. India comes out very strong as having a large number of Christian nursing programs. So that is all that I wanted to talk about. I want to have plenty of time for questions and to dive into this. As we get into the discussion, happy to share more of the data numbers, but I'll leave it here for now. And I will pop the link to the brief hot off the press in the chat. Thank you.
Carolyn, thank you for taking us through the data on that and showing us a bit of what we've learned by grappling with this database. So now you get the idea of the scale of what Ron and Gary have managed to pull together, and I have not seen anything like this anywhere in terms of just the richness of description and availability of information throughout the world. And at its core, it becomes this great asset, this great resource to explore learning, to explore development, to see what it means to work in the Christian landscape and strengthen health worker training. And how can we do that better? Well, one good way to do that better is to know who's actually providing that training, and so this is a rich resource for that. Carolyn, I know you mentioned, and I see the links in there for the data brief. Do you want to say something about actually providing access to the database itself? I don't know if maybe I missed that when you said that.
Thank you. I did miss that. We have we're storing the database kind of on Dropbox, and we have a link that you can view it. And so we're kind of sharing that upon request. So I will also drop the Mapping Consortium email address into the chat if you're interested in taking a look, or you saw the numbers and you're like, wait a second, those numbers don't line up for what I know about Uganda, for example. Please write to us. I'd love to get your eyes on it. As Gary and Ron mentioned, we are in the friend sourcing era right now of this work. So we want to hear from you. We want more eyes on this. So it is available upon request. I also wanted to make a note is we are really framing this brief and what we just presented as a snapshot. This is going to be changing, especially as we get more information, we have more eyes on it. So this is the database as of April 2nd, 2025, but we expect for new things all the time. Thanks.
Thanks, I appreciate that. And maybe we can get Ron and Gary to come on here as well. And really, friends, I open it up for comments. I did see a hand go up, but if you could jot your comment down in the chat, that's an easy way for me to keep track of the comments. And but while you are getting your comments together, and again, please put them in the chat. I'm going to just make a few just a few other cross-cutting comments. I think that through the presentations, we've really heard a lot about the inspiration and the first love. We've heard a lot about the role of tracking these programs in terms of emerging needs, And then also the critical nature of this being a living database. This is not a one and done effort. This will be an ongoing thing that we have to keep up. And the way that we keep it up is by keeping it fresh with each of you. And Carolyn, I love how you are the center point of contact. People have information, we can update the database. I'll mention one thing that as I start looking eagerly for your questions in the chat. One of the common questions that comes up is, how did we deal with hospitals that run their own training program? And because that, in some places, you might have a hospital running an enrolled nursing program. And does that, did that make it onto the database? I have a few thoughts about that but before I do try to answer that, Ron and Gary, how did you guys look at that? If were you seeing just hospitals with their own programs, and what did you do with those if you saw those?
Oh, we saw a few hospitals that were hosting universities. And so those we tried not to include because we wanted the institution with the responsibility for the training. If the hospital had appeared to have full responsibility, that they were the ones educationally responsible, then we included that when we came across those. I think we would have missed quite a few of those because the artificial intelligence search, where we're asking for institutions using words like schools and colleges, would often have slipped through. And so we often would not have known those. And when we'd get to a hospital that if it happened to have a website, and so it wouldn't be a separate website for the nursing program, and so it would be buried within, it would take a fair amount of homework to figure out. So another one where we could use a lot of help from folks who know better than we.
Ron, any further color to add to that? And I've got a little insight that I might add too. But
no, as Gary said, some of them were clear, other ones are more obscure, but it took some research. And again, we'd love for people to contribute if they have further information.
This is something that's also dynamic and changing a lot in the world. There is an effort to formalize, particularly the nursing training that has been offered in quite a number of local hospitals. They would have an enrolled nursing program. In many countries, they're phasing out those programs for a different standard of training. So it might be a diploma or up to a degree, but almost always there's some type of education institution then involved in overseeing, if not formally accrediting, the hospital programs. And so that world is changing a little bit. So we kept our focus on the training institutions for a reason. And any one training institution, you have a university, they might have 1, 3, or 5 different clinical settings that they partner with. So it becomes really difficult to track that way. Friends, I'm looking for any questions that you might have. So if you have something, please feel free to offer it. Otherwise, I'm going to get creative here. One of the
Hey, Doug, I would Doug, Gary, I think folks might love to just have a quick piece of the database. Is that possible to do here on this?
Carolyn,
That might generate some questions.
That's great.
It is possible. Thanks to Zoom screen share. All right, here we go. So
I saw, Carolyn, that we've got Miriam on from UCU in Uganda, and I saw that we've got sorry, I think it was Elsa from CMC Valor. Did I get the name right? I just blanked on your name. I'm so sorry. From CMC on there, so we could look at India too.
okay.
But maybe pick one of those and
Here is Uganda. It just fits on my screen. Hopefully it's not too small for you all.
So help Miriam find Uganda Christian University there. Looks like row 1064.
Here we go.
Miriam, I hope you're here with us and tracking what I'm doing. So you can see there, so the in the gray column, those are the medical programs. We've got your medical school. Then the blue column is the
Oral health.
oh great. Thanks, Miriam. Yep. Blue column is oral health, so that's a dental program. Okay. Then Carolyn, take us through the orange and then the other blues.
We have orange is nursing, green
You'd
is
have to go
something
out,
I'm
it's all right.
blanking on. Blue is behavioral health, and then this lighter green is other.
There you
Green's
go.
pharmacy.
Thank you.
Uh,
Thank you. Thank you.
Yeah. So literally, what you would be able to do is go on, make sure that the institutions you are familiar with, you can find them in this. And Carolyn, you want to walk through the level of information that we've got. So we've got websites.
Mhm.
What else do we have?
have websites, then we have the generalized denomination, so that's our 4 categories. Then we have church connections, so we have a bit more specificity here. We have, in this next column is kind of motivational or inspirational statements, so we don't have that for all of them, but some of them have been pulled out here. Then we have some points of contact in the next couple of rows before we get to the big table of programs here. So you can see in Uganda, nursing programs are very strong. Also behavioral health. I'm impressed at how many of these are showing up here as well. Looks like we have about 5 medical programs.
Oh, great. All right. So you can see a bit of what the structure is that's in that. So terrific. And I'm seeing some comments and questions start to come in. Here. Although poor Amaka has just put in a comment that she's lost because she cannot see Nigeria. So
All right,
next,
we can fix that.
hold on, Amaka. We'll show you Nigeria. And I appreciate, while you're going to that, I appreciate a few of the comments here, like Matthew in India. Hi, good to hear from you. Southeast Asia region nursing council websites have the data of all training institutions. So this is a way to cross-check what we've got here, make sure that they're all recognized. And I couldn't agree more, Evans, with your comment that sharing this data is a great way to identify gaps. And so providing the database, we can do that. And one of the reasons for sending it out, knowing that you're going to provide comments, is then we can chase you down to see if you've had comments. So sometimes I'll get sent something, but if somebody doesn't prompt me, I might not be on top of that. So you're quite right. But we'll be organized in how we do that. VJ has got a terrific point about unrecognized training programs, especially the certificates and some of the diploma programs are underrepresented in the training. And they, unfortunately, in LMICs, they probably are least likely to have websites. So it's most difficult to find them. So it will take some work to triangulate to find all of those. Amaka, are you happier now that we're seeing Nigeria? I hope so.
I'd like to make a note too with the programs. Like I'm very glad to see some recommendations of things we could include on here, that we are thinking strongly considering adding a column for residency programs in the future, because we know that's oftentimes those aren't as well mapped even as the institutions, and then there's a clear connection there. And so there are things like residency programs or even Masters of Public Health would be great to take a look at. So the sky's the limit for how this can grow.
Unfortunately, the sky's the limit. And so that I really appreciated Gary and Ron when you started looking at this. You focused on those where there's hands-on care that's a part of the training. So that's a good starting point. I'm looking for a question in here that we can direct to Gary and Ron, and here is one. Have areas like radiology technician, lab techs, and theater techs been included? Gary and Ron, do you want to come on and make a comment about that?
Right. Yeah. We tried to limit it, as Carolyn mentioned. We went for 18 disciplines, so we could keep adding as we mentioned, and it depends on this group and how deep we want to go. But we try to get the most common disciplines that we saw a pattern with and include those. So we did expand out on the other. We had, physical therapy, occupational therapy. We had optometry and audiology. So that's about as far as we got. But if we want to add others like radiology tech and others, we can do that. So lab tech, radiology tech, and theater tech, I think were the ones mentioned.
So some of that might come down to how the data starts to get used and what people are looking at the data for. So I think about technology development in low and middle income countries as one of the biggest things to happen, with a fair bit of corporate backing and then internal financing. And Ron and Gary, please stay on. You can both stay on. Because this is discussion time. So please keep camera on. Thank you. Don't hide. With the advances in medical technology, maybe that is also an important direction, is to make sure that we've done more to capture those programs.
I see an interesting question in the Q&A box, actually.
Oh, good.
Is there any kind of assistance or support of any nature that someone could receive from CCIH when attempting to create a local or national Christian training program?
You've put the question out there. Do you want to start with answering that? And I'd love to know, from Ron and Gary, what do you see? What's your reflection of what how do you think about that? Also, I don't want
Thank
to
you
speak
for
for
asking, Doug.
yeah.
Doug, that's a softball pitch. Ron, in his role with this National Association of Community Health Centers, which, by the way, over the last decade has been the biggest growth in residency programs, I think, in the world. Added about 200 residencies in the health center movement there during that time, and our chances to work together in starting medical and dental and PA schools. We felt called by God to step away from that in order to walk along with health professions, educate Christian health professions, educators in the world. So if nothing else, we would love to meet folks who could and share our ideas, and as we have a burden for health professions, educations in the world.
Yeah, and as Gary mentioned, I think we're kind of balanced in terms of our relationship. I'm more on the clinical side and systems change, getting training programs and residencies. Gary was more on the ground working with the university, and was mentioned on his introduction, was heavily involved in the accreditation of actual programs. So he knows the nuts and bolts of getting a program actually accredited. So we come from different angles and approaches, but it is efforts. But however we can help, we would love to do that.
So Doug and Carolyn, I think we'd love to be considered as a resource that CCIH can use with its members. So if you want to think of it that way, plug us in where you
Fabulous.
think we ought to be plugged in. So if
Well,
we can be of help, we'd love to.
And some of our members are actively pursuing ideas around these things. I know African Mission Healthcare is active on that. The CAP, the Christian Academy of African Physicians, is working on that. And I think, Amy, did I see, is that you from CAP? or are you a different Amy? I'm sorry, I can't remember. But you've got a similar question in here about medical focused residency programs. Good. Yep. You know, so several of our members are thinking like this, and there's two mindsets about this. One is creating residency programs for missionaries and overseas people to go get experience. That is one thing that I know the missions community spends a lot of time talking about. But the other side of it is creating local residencies and strengthening local residencies for enhancing the local training. And that's where groups like CAP and AMH and gosh, PAX and several others are doing such foundational work. Um, and then Amy's got a good point here about go by a list of medical needs for a country and go from there instead of from what is available. Highlight gaps and that no one is addressing. I think if we do that, one of the things that will pop up that keeps coming up through all of our dialogues is administration training. And Gary, this gets right to your wheelhouse. The paucity of really terrific medical leadership, governance, administration kind of training programs out there, and particularly those that emphasize or focus on Christian Christian institutions. There are some good examples out there, but that's certainly one we could point at. Any other ideas about areas that you've maybe seen or needs that might come up? Questions that you've even
Yes.
come up with? Yeah.
Yeah, I have sort of a big picture question. Says this is a big picture and it begs a big picture question. What's the venue, Doug and Carolyn, for the church universal to be considering strategy, right? We should now be able to look at the world and say, there's not enough of this here. How are we going to help, as part of the kingdom? How are we going to help that happen? What is there like a committee? Is that the mapping consortium group? How do we think big picture and doing, becoming the church that we're supposed to be?
Yep. Amen. And that, from the days that we set up the whole Christian Health Asset Mapping Consortium, it was with that big picture in mind. Sitting around realizing the people have talked about it, tried different efforts to create something, and one of the strategies we picked in this was there's already a lot of local data that exists, a lot of local knowledge. We just need to bring it together into one roof and then have the global networks and global influencers grappling with it and interrogate what it means. It's remarkable if you look at like Carolyn was presenting the data from India versus Tanzania. You might see numbers of programs, but the populations are vastly different between the two contexts. But then the percentage of Christians in the countries is also quite different. So how do we think about Christian health worker training in light of the emerging medical needs? That's the conversation we're trying to stir, even at CCIH. Okay, good questions coming in from the side over here. How much time did it take for you guys to pull this together, Ron and Gary? If you had to put an estimate on hours invested in this, 2, 5?
I think it was
8?
probably sort of half a man year, maybe 2/3 of a man year. Yeah. So what's that? About 1,500 hours.
Right. So this is a huge investment, and at risk of overstating it, I can't overstate how grateful we are that you took a swing at this, because nobody else has done this before. So it's going to take some time, and I think Amy's right that it's also going to take time to fill in missing data, and that's where people that are on this call are going to play a part in helping fill in those gaps. Let's see. Vijay's got a good point about strong witness to patients and among staff as well. Agree. The need for quality being high. Building such training programs in Christian institutions would be valuable for the countries they are in. Could not agree more. Could not agree more. And presentations are awesome. I agree. The presentations are awesome.
Doug, if it's
Carolyn?
okay, if I can take Evan's question about
Yeah.
possibly would CCIH be open to supporting collaboration on locally led practical training programs for community health promoters rather than heavy academic approaches? And thinking about the connection with primary health care. That is something we've had a discussion on and are considering as well. I think I'd like to highlight that last year we did do a scoping exercise of Christian community health programs. And we have a brief on that. And that mapping exercise was pretty difficult because those programs aren't as well documented as the schools and institutions. So I would say that is where we've started with those programs. I think building onto that would be, okay, what kind of training goes into those programs? It could be another niche study off of that. And I can put the link to the community health, faith-based community health programs work in this chat as well. But definitely that has, when we've had conversations about this work and what we see for this database, we know community health workers go through all sorts of different types of training, and it would be really helpful to have documentation, better documentation of that as well. Thanks.
Terrific. We're at the top of the hour. This hour has absolutely flown by, and I'm seeing a lot of other comments and questions coming in here. Ultrasound programs, I think we talked a little bit about technology. That can be something that we add. Glad the database looks helpful. And certainly, for those that aren't, Gary, you're stirring the pot here a little bit about where do we go from here, and how do we, what's the venue for the big system thinking around this? That is a really big part of what we try to cultivate and bring together as many people and partners within CCIH as we can, and why we are so invested in the mapping consortium. So we're in the right neighborhood. But wow, we have limitations. And just looking at this, the 4 people on this call, we do not represent the vast majority of the world that we try to serve. And so the opportunity now is to make sure that we double down on that and create a collective voice, a forum for that collective voice. Friends, we are at the top of the hour. I think this is when we're supposed to wrap up. Ron, Gary, any last sentence? Carolyn, any last sentence you'd like to offer, or parting word?
Just again, thank you all for what you have done and are doing out in the field to further the gospel and health professions education in the Christian context. And again, we stand ready to contribute and go further with this to God's glory.
I see an amen thumbs up from Gary. Anything else?
I think
Great.
that
Carolyn?
feeling very blessed to be part of this. So
Great.
Just noting, it's amazing to see people's motivations and inspirations and interest in the chat. Please do keep up with us. Join our Google group. And we will be excited to hear from you as we move this forward. Thanks.
So exciting. We're going to share a 1-question survey in the chat. Oh, it's already there. Good. Thank you, Kathy. Please complete that. It's 1 question. It's how we learn, how we can do this better. And I am so grateful for everybody taking time to be with us, and thankful again to Ron, Gary, and for all of their heroic work in this. Carolyn, for your faithful work in pulling together the brief and the data analysis. And so let me pray us out as we go. Lord, we thank you for this time and pray that all of the thoughts here honor you, help us carry away inspirations, fresh inspirations and ideas that influence us in our work. In your mighty name, amen. Thank you, everybody. Have a wonderful day.
Thank you.